Hello friends. Today I am going to tell you about African trypanosomiasis, African sleeping sickness. But before that, subscribe to the channel if you have not subscribed till now. African trypanosomiasis, also known as African sleeping sickness, is a parasitic disease caused by two subspecies of the Trypanosoma brucei parasite. It is transmitted to humans through the bite of the tsetse fly, which is found in sub-Saharan Africa. The disease affects both humans and animals and can be fatal if left untreated. Symptoms of African trypanosomiasis usually develop over several weeks or months, and can be divided into two stages, early and late. During the early stage, patients may experience fever, headache, muscle and joint pain, and enlarged lymph nodes. They may also develop a skin rash, ulcers, and swollen eyelids. As the disease progresses to the late stage, it can cause more severe symptoms such as confusion, seizures, and difficulty speaking and walking. This is due to the parasite's ability to cross the blood-brain barrier and affect the central nervous system. Treatment for African trypanosomiasis depends on the stage of the disease. In the early stage, treatment usually involves medication to kill the parasites and prevent the disease from progressing to the late stage. The two main drugs used to treat early-stage African trypanosomiasis are pentamidine and Suramin. These drugs are administered intravenously and can have side effects such as fever, rash, and low blood pressure. In the late stage of the disease, treatment is more complicated and requires stronger drugs that can cross the blood-brain barrier. The two main drugs used to treat late-stage African trypanosomiasis are melarsoprol and eflornithine. Melarsoprol is an arsenic-based drug that can be fatal if not administered properly, and eflornithine is a safer alternative but is more expensive and requires a longer treatment period. Preventing African trypanosomiasis involves taking precautions to avoid being bitten by the tsetse fly. This includes wearing protective clothing such as long sleeves and pants, using insect repellent, and avoiding areas where the tsetse fly is prevalent. Travelers to sub-Saharan Africa should also consider taking prophylactic medication, which can prevent the disease from developing if taken before exposure to the parasite. Currently, there is no vaccine for African trypanosomiasis. However, researchers are working to develop a vaccine that can prevent the disease from developing. The vaccine is still in the experimental phase and has shown promising results in animal studies, but more research is needed to determine its safety and efficacy in humans. In conclusion, African trypanosomiasis is a serious parasitic disease that can be fatal if left untreated. Symptoms can develop over several weeks or months and include fever, headache, muscle and joint pain, and enlarged lymph nodes. Treatment involves medication to kill the parasites and prevent the disease from progressing to the late stage. Prevention involves taking precautions to avoid being bitten by the tsetse fly, and travelers to sub-Saharan Africa should consider taking prophylactic medication. While there is currently no vaccine for African trypanosomiasis, researchers are working to develop one that can prevent the disease from developing. Thanks for watching. Subscribe to the channel if you are not already subscribed.